critical care nursing is, it's more intensive, it requires more monitoring, and the nurses that work in critical care are general nurses with additional training. It's in addition to the general nursing course, and the time for the training varies from one jurisdiction to the next. Some areas are 3 months, some 6 months, and some places up to a year. So we currently have our full staffing, which is 22 nurses. Many times people want the 22 nurses for just 9 beds. Well, it's needed because at any given time, depending on how ill the patient is, we can have up to 6, 7 nurses per shift because of how unstable or ill the patients need and the monitoring that's required.
As a critical care nurse, the name itself speaks volumes. It's intense monitoring and advanced care, advanced treatment and treatment procedures as well. So we have a very small ratio, nurse to patient ratio, because we have to monitor them much more closely. At the most once every hour at least, we take vitals, sometimes once every 15 minutes depending on how critical they are. So my role is to monitor and report back to the doctor if necessary, any interventions that may need to be taken, and take the initiative as needed as well too. So these are patients that can deteriorate quickly at any point in time. So it's it's very intense, especially it's very intense thought process, let's put it that way. Your mind always has to be on, you're always looking for what can go wrong, preventative as well, so that you can prevent it, treat as it comes by. So it's intense nursing, so I guess they call it intensive care unit.
We have the ability to overflow to another area. We have our PACU that has been set up for ICU overflow in emergency situations like this. And we are prepared for it. We have the equipment, we have additional staffing that's ready to support us, or PACU or nurses who are trained up to support us in case of an emergency.